Welcome to the Harvard Health Minute. I'm Dr. Terry Schrader. Did you know that exercise not only benefits your body, but also your brain? Research now shows exercise can improve our memory, our problem solving, and may even reduce our risk for dementia. To help explain this to us today is Dr. Alvaro Pascal Leone. Welcome.
Hi.
You're a professor of neurology at Harvard Medical School, a leading expert in this field. Tell us what you say to patients about this subject.
Well, so I tell them that we can make a diagnosis and prescribe medications, but that the best treatment they can possibly get is to start exercising regularly. That physical exercise is probably as important, maybe more important for their brain as it is for their hearts or their bodies.
Can you explain exactly what's happening in the brain when we exercise?
I can try. There is lots that we still need to learn, but we've learned a lot. We know that the exercise makes overall our heart work better, our blood pressure be better controlled, our muscles be more effective, and with that there is effectively more blood supply and more sugar that goes to the brain. A healthy body is good for a healthy brain. So that's one benefit. It turns out though that in addition to that, exercise literally changes the brain. It makes parts of the critical parts of the brain more plastic, more capable of adjusting to challenges, of learning new things. It literally makes new brain cells in key parts of the brain that have to do with memory and with problem solving and executive functions. So thanks to exercise, our brain connections work better.
Can you explain to us exactly how it works in the brain, or show us? Can you teach us some neurology?
I can try. Okay, so let's start with our brain. So this is our brain. Just to orient ourselves, this is the skull here. So the nose would be somewhere here. These are the lips, the chin. So that's our brain. Now, sort of right under the eye, right here, is this part of the brain that we call the prefrontal cortex. And this prefrontal cortex is critical for decision making, for executive function, for planning. That's one of the parts that becomes better connected with the rest of the brain, and where the thickness of the connections of the gray matter becomes greater thanks to exercise. The reason why this is important is because this part of the brain does a number of things, but it also controls areas deep in the brain that have to do with emotion, like amygdala. So by having a stronger prefrontal cortex, we have better control of our own impulses and our own emotions, including the impulse to eat. So exercise is helpful because it burns fat. It's also helpful because it makes us better able to resist the impulse to eat. Another important area is deep in this part under the ear, the temporal lobe. And this part of the brain that we call the hippocampus has sort of this funny C shape deep in the brain, not in the surface of the brain. That has to do with memory. So this is memory related. This is executive function related. And in the memory area, we also literally make new cells. There are new cells built here that are then sent around the rest of the brain thanks to exercise. So if you had to pick two areas, this executive function area, prefrontal cortex, and this mesiotemporal or hippocampal structures are the main targets of the benefits of exercise.
What types of exercise are you talking about? Is it running, walking, weightlifting, swimming? What types of exercise would be best to benefit the brain?
So probably it doesn't matter. What is critical is that we push ourselves more, a little bit more than what is necessary for cardiovascular health. So we've learned a fair amount about what one needs to do to get the heart pumping, to burn fat and benefit from exercise that way. Aerobic exercise, but also weightlifting can be helpful there. To gain benefit for the brain, you need to push beyond what you think is sort of your limit. It turns out the first thing that sends us a message of fatigue is our brain, it's not our muscles. But we're far from the point of fatigue when our brain starts warning us. We give up, as it were. Our brain tells us, don't go, don't go. What we want to do is actually push beyond that moment. When you feel like you could continue to go, you can stop. So I think what is helpful is to commit not to a lifelong of exercise, commit to the next 3 weeks. You're going to do 4 days a week for the next 3 weeks. Do so with a friend. You're going to partner with somebody, and each other are going to motivate yourselves to make it work. If you do that, then it turns out it gets easier and easier. But more importantly, once you've gotten to that month of exercise, you'll miss it because you will notice that you're in better shape, but that you're also thinking clearly, that you have more energy.
How do you keep exercising? How do you motivate yourself?
I go to the gym every morning. I drive in. A big motivation is I don't want to be stuck in traffic, so I go really, really early. I'm lucky that I can go to the gym right at work, and I go at 5:30 and exercise for an hour and then have a nice coffee afterwards. It helps me face the day with better energy.
And helps your brain.
I think all evidence suggests that it helps those that are still functioning well function better, and those that have cognitive problems related to age or to disease, to dementia, it helps improve their quality of life, it improves their well-being, and it's a big part of the prescriptions that we should be giving patients.
Thank you, Dr. Pascal-Leone. You've given us some important reasons to keep or at least begin to exercise.
My pleasure. Thank you.